Chest pain is a common patient complaint and must be treated as a medical emergency until proven otherwise, as there are several life-threatening underlying causes. The top priorities to exclude or promptly treat serious cardiac and non-cardiac causes. And a good history and examination is very helpful in this endeavor. Causes. So the common cardiac causes are stable angina, acute coronary syndrome, and pericarditis. And non-cardiac causes include gastroesophageal reflux disease, pulmonary embolism, pneumonia, peptic ulcer, esophageal spasm, and pleural effusion. Other causes to consider are aortic dissection, mitral valve prolapse, and other valvular problems. Also, coronary vasospasms and sickle cell disease in acute chest syndrome, hiatus hernia, esophageal tear with mediastinitis, and also biliary tree disease, costochondritis, and nerve root compression, cardiac neurosis or Da Costa's syndrome, and also herpes zoster. Symptoms for myocardial ischemia: quality of pain is crushing, tight, heavy or band-like. Site of pain: central anterior chest. Radiation to the throat, jaw, arms, or nowhere. Exacerbating factors: exertion, anxiety, and cold. Rest and nitrates are the relieving factors. Associated features: nausea, vomiting, sweating, dyspnea, shock. For aortic dissection: quality of pain, tearing. Site of pain, central. Radiation to the back. Exacerbating factors: there are none. Also relieving factors: none. Associated features: shock, cyanosis, sweating, right and left arm BP difference, and also new aortic regurgitation murmur. For pericarditis, the quality of the pain: sharp. Site of pain: central anterior. Radiation: usually there is no radiation. Exacerbating factors: as lying supine. Relieving factors: sitting forward. Associated features: fever, recent viral illness. For pleuritic pain, the pain is sharp as a quality of pain. Site of pain: anywhere in chest. Radiation: usually none. Exacerbating factors: is exacerbated by inspiration and also coughing. Relieving factors: none. Associated features: cough, hemoptysis, dyspnea, and shock. For example, in massive pulmonary embolism. For peptic pain, is burning in quality. Site of pain: central. Radiation to the throat occasionally. And exacerbating factors: spicy food and alcohol. Relieving factors: bland food and antacids. Associated features: bloating and wind. For musculoskeletal pain, they're usually sharp and dull as a quality of pain, and also site of pain: anywhere on the chest wall. Radiation to arms or around chest to back. Exacerbating factors: pressure on chest or moving neck. Relieving factors: restriction of movement, and also associated features. A patient looks well. So the signs that are usually elicited include shock, pallor, sweating, in myocardial infarction, dissecting aneurysm, and pulmonary embolism. And dyspnea in myocardial infarction with left ventricular failure, pulmonary embolism, and pneumonia. Also, blood pressure could be normal or high. When it's low, it suggests cardiogenic shock. And when a difference is more than 30 millimeters mercury between the arms, then it suggests aortic dissection. For the pulse, the rates could be high, low, or even normal. It could also be regular or irregular. Memes consider valvular heart disease. Pericardial rap suggests pericarditis. For unequal chest expansion, may indicate pneumothorax and pneumonia. Reduced or absent breath sounds, as for pneumothorax. Bronchial breathing in pneumonia. Pleural rap, you consider pneumonia and pulmonary embolism. And also abdominal tenderness or epigastric tenderness, you consider peptic ulcer disease. For Garden, perforated ulcer and peritonitis. And reduced bowel sounds, as paralytic ileus or ileus. For chest wall tenderness, you think of musculoskeletal cause. For investigations, they are specific to the condition at hand. So the main treatment objectives are symptomatic relief of chest pain, reassurance to minimize anxiety, treatment of underlying cause, and also for non-pharmacological and pharmacological treatment, it has to do with a specific condition at hand. So referral criteria, you refer when there's persistent unexplained chest pain.